I'm Dr. David Marais, head of the lipid clinic at Groote Hospital and of the lipid laboratory at the University of Cape Town. There are several inherited disorders of cholesterol and fatty acid metabolism that can affect health very seriously. The commonest one in the world is familial hypercholesterolemia that affects approximately 1 in 500 people. This condition is recognized by a pattern where the LDL cholesterol is higher than 5 millimoles per liter and where patients often exhibit thick Achilles tendons and the family or the patients have heart disease prematurely. Making this diagnosis is important because it identifies subjects with very high risk who can benefit from treatment that has been shown to be very effective in reducing this risk. Some populations have higher prevalence of familial hypercholesterolemia, and the reason for that is migration. When a group of people migrates, then there may be a selection for or an enrichment of a particular gene in that new population. When the Afrikaner population was established, the gene for familial hypercholesterolemia was enriched and is present in about 1 in 75 people. Similarly, immigration into South Africa of the Jews from Eastern Europe and Gujarati-speaking Indians from India led to enrichment of FH in those populations. The familial hypercholesterolemia pattern can be due to more than one genetic error. The commonest genetic error is when the LDL receptor is defective and does not remove LDL from the blood. The LDL receptor binds ApoB on the LDL particle, so it is quite logical that errors in ApoB can result in the same pattern of illness. Lastly, a different enzyme that degrades the LDL receptor has been found to cause the same disease. The genetic diagnosis does not have to be made for treatment to be started. It is hoped that all patients with familial hypercholesterolemia will be identified, as the average age for men to have an heart attack is 45 and for women 55 years. Treatment is highly effective. We hope to see that familial hypercholesterolemia will be identified young and treated effectively in this country.